patients have a concern about return to sports after they've had this injury. The initial, it's almost like the stages of grieving, where there's a little bit of denial at first, and then there's, really sadness, and you kind of got to get over that and help them get through that, and then give them some hope, that, hey, you can come back. We do this. This may be your first ACL, but it's not our first rodeo. We can get you through this. We've got the team to do it and the right rehab protocol to get you through, and just kind of give them some milestones that let them look forward to different stages, of getting better. And you don't have to give them everything at once. And one thing that I tell them is that, if you'll feel more normal, get you back with your friends, and feel like a more normal kid if you get where you're walking well. Get your knee straight. Your pain will get better, your swelling will get better. Get where you're walking well. You can straighten your knee out. You don't kind of worry about your knee and you're not apprehensive. And then you're back in your peer group. And I tell parents, keep them with their peer group because they may not be playing, but you can be on the bench because you're not any good or because you're hurt. And you're still part of the team. So I think that's important for their psyche. Keep them around it, and that gets them looking forward to getting back out there too. So there's some mental aspects to this. You can give them milestones and tell them, hey, you'll start feeling a little bit more like an athlete when you start jogging. You get back in the weight room. We'll let you have a little fun. We'll let you do some of your workout routine, upper body, You can maybe give them I don't think there's anything really inherently good about tearing your ACL, but there are good things that come out of it, just like a lot of infirmity that we have. Maybe you can say, okay, I've got 7 months here, 6 to 8, let's say, months of a window of opportunity. I'm going to work on my whole body. I'm going to work on my nutrition. I'm going to lose a little weight. I'm going to put on some lean muscle mass. I'm going to get upper body strength. I'm going to reproportion here. I'm 16 years old. Your body's not through maturing. And so if you give them some things to work on and some things to focus on, where you can say, hey, maybe you come out of this better on the tail end because you spent the last 6 months really working on a lot of things that other kids weren't working on. I think you got to give them hope. You got to give them something to think about other than the woe is me stuff and that, I might not ever play again. Point them to peers, friends. You don't have to look around very far to find patients and good players, at the highest level that have come back from this and done totally fine. So that's an important thing for them to focus on. They can look at people in the rehab center, who are a little bit ahead of them and say, okay, in a month or 6 weeks, I'm going to try to do better than that, And I kind of joke around with the girls sometime and tell them you need to go in and whichever boy had surgery the same week you did, you need to make sure you're doing better than he is, Just appeal to their competitive nature a little bit.